Pancreatic Cancer Action is a charity, and it's a charity that is particularly focused at improving the outcomes, the early diagnosis, and the patient experience, and for both people who happen to be dealing with pancreatic cancer as a disease, but also for their family and friends as well. The charity's kind of key thing that drew me to them is that phrase action, and there is a very focused, very proactive charity in terms of as key sort of the key interventions that it believes would improve pancreatic cancer diagnosis. And one of those is the fact that it does really advocate for the realization that community pharmacies play a key role, because like you said, majority, and we know the evidence, behind this is really quite staggering. We're talking about, millions of people that go into the community pharmacy every week to discuss their clinical needs. And the NHS knows this. That is why every time we're looking at any sort of NHS campaign to manage pressures in the NHS, it tells people to go to the community pharmacy, rightly so. So what the charity does advocate is how do we make sure that we improve early cancer diagnosis for pancreatic cancer using the skills of community pharmacy. It also talks a lot about how we also create a better multidisciplinary working, how we support people that have in treatment, and how we share information to people as well, especially for non-specific cancer symptoms as well. How do we raise awareness of that? How do we make sure that people have this, the right level of reassurance? At the same point, they have the right level of knowledge, which we don't want to make people become well and anxious. But if we get that balance right, it is there. And one of the key things to that is the anxiety that people have about, but if this gets worse, where do I go to? Is to say, well, you can come back into community pharmacy. So how do we do that? So that's a lot of that work there. So the charity does the work through a variety of ways, and they've got 3 clinical ambassadors. It's myself for pharmacy. They've got Dr. Ellie Freeman, who is a GP, and they've also got Dr. Hilary Jones as well. So that's a bit of how Pancreatic Cancer Action works.